Today we've got a really interesting case. Tim's presented with an issue with his right biceps where all of a sudden he's lost power when flexing the muscle. So he actually first felt this at the gym when doing just barbell curls, feeling that he was only sort of pulling the weight up through the left one. And so he's come in, and when he sort of feels it, he can't quite get the contraction through here. And so you might even be able to see this. So here's Tim. And let's do the double bicep pose. So let's have a look. And you can actually see, like here, when I push down that one, no problem. And then we come around to this one here, it kind of like, it's squishy. There's no power and contraction through this. And Tim's wanting to, really push himself with bodybuilding. So this is a huge issue. Tim actually came in a few days ago and we looked at treating just those muscles. Was it a little strain in those ones in particular? Today, 2 days later, he's come back in, no change. So we know it's not just a local issue in the bicep or potentially the brachialis under that, but more of a nerve supply issue. So the nerve that controls this is the musculocutaneous nerve, which is a branch through the lower part of the brachial plexus, which comes down through here. And it's actually really commonly entrapped in a muscle through here called the Coracobrachialis. And we're going to get into that today. The coracobrachialis runs from a bone on the underside of the shoulder blade called the coracoid process to the humerus. So it's jacked. You can feel it in there. It's not comfortable at all. So that's going to be the primary muscle that we're going to treat in a moment using active release technique. But then we can't just treat this muscle in isolation. So it's one of the muscles that will bring the arm down and in. So all those supporting muscles, the pecs, the lats, the subscapularis, we've got to work on those as well to make sure that shoulder is in the right position. And then I'm going to go above it as well, treating some of those muscles that could be entrapping that as well up in the scalenes and the subclavius under the collarbone there. So to start with though, let's hit that major player, the coracobrachialis. I think we're going to see Tim in a little bit of discomfort here.
This could be good.
Yeah. All right. So using active release technique, what I like to do is it's kind of a pin and stretch technique where we find the tension in the muscle, where that nerve is entrapped a little bit, create stretch through there as I maintain that same pressure throughout it. It's quite an uncomfortable technique, but generally patients will see instant changes with this. Nerve issues, it'll probably take a couple of days to be able to feel that ability to flex through there because the nerve tissue itself has to heal too. It's not just take the pressure off and then the signal restores instantly. Good. That's it right there. And the interesting thing with Tim here is there was no sort of onset of injury. There's no sort of, you can't think back and be like, oh, I did this dumb. So usually what I see with scenarios like that is there's some sort of technique issue, or there could be an underlying postural issue where the control around the shoulder blade, around the shoulder itself, the wrong muscles are working too hard. So after we sort of take the pressure off this nerve, we'll have to identify why did this happen and make sure it sort of doesn't come back. All right, let's give that muscle a little bit of a rest. You did well there.
Thank you.
So the next one we want to hit is the subscapularis, if you want to come around here. And it's on the undersurface of the shoulder blade. And again, this one, not the most fun one to get treated.
It's a good day in here today, mate.
Yeah. So I'll generally find this muscle, the subscapularis, will start to get really tight with pressing movements. Generally bench type movements, you'll start to really load this muscle. And it's one of those hard ones. You can't specifically stretch the subscap. It just needs a release from time to time if you're pushing your body as hard as some of these bodybuilders do. And one more. I reckon let's get you laying on your side facing away from me. We're going to hit the lats next just because that subscap was pretty nasty. So again, another internal rotator of the shoulder. But we'll come up nice and high where that, closer to that coracobrachialis and where the subscap was as well. Just try to improve that range of motion through the shoulder because I think there's probably some sort of postural issue with the shoulder where it's slightly internally rotated at the humeral head there. One more pass. All right, now let's get you laying on your back again. So the next muscle that we want to treat is the pec major. So it sort of runs down like this. And like I was saying, I think that humeral head is a little bit internally rotated. So this is going to be a game changer to get into that. And you can just feel it. It's fibrotic through there. It's really like ropey and yeah, we got to change that. So letting that arm fall out. So Tim, have you increased bench press or increased volume or anything like that?
Yes, mate. There's been a constant build.
Yeah, right.
Over the last sort of 12 months. So
Okay.
yeah, it's been a better performance.
12 months, your body should be pretty well adapted to it. Would you say you've added sets in the last month or so?
Hasn't been a set change. It's just been a progressive weight
Just loading it.
increase.
Yeah. And we haven't really treated the shoulders too much, so it
No,
could just be that slow overload. It's that bit right
Whoa,
there.
yeah, you got it.
One more pass. All right. So the next one we want to hit, Pec Minor, which is just deep to that. So it actually attaches at the same point as the coracobrachialis, so off the coracoid process and then into the ribs there. And so it's sort of protracts and retracts the shoulder blade. So you just relax that arm and I'm going to drop this back and down. There it is. And this one actually doesn't feel as bad as the Pec Major. I think that's where all that positional sort of dysfunction is coming from. And so what I'm going to do then, we're going to come up closer to where that brachial plexus is, sort of where that branch then from the musculocutaneous nerve is affected. Make sure that we're not getting entrapments up in there. So subclavius, I roll under the collarbone and try to peel that away. Again, not too bad there, so I think it's all through the pecs, subscap, coracobrachialis. Good. We'll hit that last muscle, again, just finalizing, making sure the brachial plexus is happy. Scalenes on the side of the neck, so I often see sort of with bodybuilders, the scalenes, it's kind of a big fan-like muscle all through here. We want to hit this anterior part through here. So just let your head go nice and loose there. A little bit of tension, but again, I don't think this is the issue. For Tim, it's all positional, internally rotated shoulder. That coracobrachialis is in a chronically shortened position. It's sort of clamped down on the nerve. And I feel like that's why that biceps isn't able to contract properly. So moving forward with this, usually nerve entrapments, I'd like to do 2 to 3 treatments, take all that pressure off, and then we'll start getting on some scap retraction work to get that sorted out. If you've enjoyed this video, I'm going to link you to another video all about rotator cuff injuries. Until then, I'll see you next time, guys.